This segment of Delmarva Life is brought to you by Delmarva Dental Services.
It's usually the first thing people notice when they meet you, your smile. And many of us spend a lot of time and money making sure those front teeth are white and sparkly.
But did you know that your smile depends a lot on your back teeth as well, even though you don't see them? So when something goes wrong and you lose a back tooth, your mouth is like a chain with a weak link. And that's why Dr. Joseph Harmon of Delmarva Dental Services in Salisbury showed Lisa what happens when you don't bridge or fill that gap.
Daniel Parks knew something was going wrong when he felt pain around his dental bridge.
I woke up one morning and my tooth was hurting really bad, and I called Dr. Harmon. He said to come in. That's when he realized that I had developed a cavity underneath the bridge I had done.
So when Daniel came in, before he came in, this is actually an x-ray of what the bridge looked like before he came in. It's an older x-ray. And you can see there's a bridge here, and it's a fake tooth attached to two teeth. What happened was he had a cavity right here, and that's what this dark area is. And this cavity was pretty extensive. It actually almost went right between the two roots. So, and it's very hard sometimes to see a cavity around a crown or a bridge. So he had to lose this tooth. We actually had to pull this tooth. And what we did was we placed one implant where the tooth was, and we placed one implant where the fake tooth was. And then after that, these are actually our crowns that we put on top of the two implants. And that is what Daniel looks like today. He's got two implants with two crowns on it.
Daniel's bridge was a previous option to replace a missing tooth, something Dr. Harmon says is important. All of our teeth function together so we can eat.
The front teeth are sharp and narrow, and the back teeth are flat and broad. And the front teeth are really made for cutting and tearing, and the back teeth are made for grinding.
To further explain, Dr. Harmon had me bite into an apple.
And notice that cut the apple. Now, after you're chewing, where are you chewing right now? You're back on your molar teeth.
He then had me bite an almond in half and then try to chew it with my front teeth to show what it would be like to not have the back teeth.
And therefore, there's a lot of consequences to not having back teeth. A lot of people think because they don't show, they're not important.
Those consequences include the wearing of the front teeth from chewing. And since teeth hold each other in place, there can be drifting of the teeth.
So teeth will look for other partners, and they'll drift or move to looking for another tooth. When you lose enough teeth, because your teeth hold your facial bones and structure and your muscles in place, you start to have collapsing of the face.
There are 3 ways to replace missing teeth. The first is a removable option. Dr. Harmon says they can be made out of metal, plastic, or a combination of metal and plastic. Another way to replace missing teeth is with a fixed option, such as a bridge. That's what Daniel had.
What you do in a bridge is you cap the adjacent teeth, and then the fake tooth is attached to both of those. So it's like if it's one missing tooth, it's 3 units, one on each side attached to a fake tooth. Or it could be 4 units where you attach 2 fake teeth in the middle to 2 teeth. It can even be 10 units. There's all different kinds.
Another option is to replace a missing tooth with an implant.
The advantage to the implant is you're not grinding down an adjacent tooth. And it's easier to clean because it's not a complicated device that you have to kind of get under, and therefore it's less likely to get a cavity.
And that's what happened to Daniel.
He got a cavity under his bridge, and it got big because it wasn't seen, it wasn't picked up on x-ray, and then he got to the point where he had to lose one of the teeth that were holding the bridge in.
Daniel says it was the right decision.
Oh, it feels great. I would recommend the implants anytime. No more pain, take care of them just like you do regular teeth.
Now, Dr. Harmon says that not everybody can get the implants, and the bigger the space that needs to be filled, the more complicated the process becomes. So you need to take that into consideration as well.
Good to know.
Yep.